answer any questions. Thank you very much.
Thank you. I think we'll move forward because the next two items also deal with this issue. I thank you very much for that report. I recommend everybody read it carefully, and it's available for all. We have a discussion on COFA now.
No. We've got two more here. This is Reverend Joe-Silem, right?
Two more on this.
Yeah, and Jeremiah.
I'm afraid we're out of time, so if you would just take a moment, each, please take very brief.
Okay.
We want to hear about COFA, we want to hear about basic health plan, which relate to both of this. But please, let's go for it.
Okay. Chair Grinlick and members of committee, thank you for allowing us to speak. I'll just be very brief right now. I am Joe Inlet. I come from the island of Chuuk in the Federated States of Micronesia, so we are part of the COFA countries. I'm just here in support of the Mend the Gap report, as well as the report that's coming up next, the COFA report from the DCBS office. Basically, I'm here to say that along with legal permanent residents who face the 5-year bar and other immigrant communities, COFA Islanders are excluded from coverage and are left with little to no options. Many of us face a lot of health issues. I am a pastor in the community, and I perform way too many funerals for our community members who have no access to any kind of health service because we are barred from Medicaid categorically. And even though we do qualify for APTC or tax credits under the exchange, that's very unaffordable still for our community members, and that is why it's very exciting for us to see that Oregon has been a leader in trying to address this issue. And last session, we thank you for passing HB 2522 last session, which is recommending or providing recommendations through the work group with DCBS to see how we can address this problem. And so we thank you for that, and hopefully we can continue to move forward and work to come up with a plan and really implement this plan to address issues for community members like COFA residents. Thank you.
Chair Grinlick, members of the committee, my name is Jeremiah Rigsby. I'm the Senior Manager for State and Federal Regulatory Affairs at CARE Oregon. As many of you know, we wholly own Columbia Pacific Coordinated Care Organization in the northwest portion of the state, Jackson Care Connect down south, and we're a big part of HealthShare. We have about 149,000 lives within HealthShare, and those are all OHP lives through the CCOs. We surveyed about 130,000 of our adult population. About 25% of them are from communities of color, and about 11% of our adult population, we have no idea what race or ethnicity they are. We're still working on getting accurate data in to figure out who is from a community of color and what services they need. But that's exciting because we're also starting to see some of the disparities between the different races regarding the healthcare that they use and what type of problems there are. We're in complete support of the Mend the Gap report because I think it shines a light on a lot of the differences and a lot of the disparities that we're starting to see within this population. I think it fits right within the wheelhouse of what CCOs are supposed to accomplish when it comes to innovation and when it comes to addressing disparities that have not been addressed yet. And as CARE Oregon, being a member of a number of CCOs, I think we have an interest in addressing those disparities as we're serving a lot of this population.
Thank you very much. Thank you both very much. We have two more topics. We were told we needed 5 minutes to talk about COFA.
Okay.
I'm not sure how we're supposed to have four.
Representative Olson is out here, and he's bringing up Lloyd and David. Representative Olson said he is only going to take 30 seconds.
Come on. Come on.
Thank you, Representative G.
You can get 30 seconds of our committee anytime you want.
ONG.
Lloyd, you want to join us?
Yes. And then we'll bring Pat up, Mr. Allen, when he comes back into the room.
Okay. Let's go.
Okay, thank you, Mr. Chair and committee members. My name is Andy Olson. I am the state representative from the Albany area. Just want to take just a quick, brief moment here. Thank you very much. Earlier last session, moving House Bill 2522 down to the subcommittee, and because that was an opportunity for us to really have a good evaluation of it. From there, we did move it forward through this building and then had DCBS to take a look at it. I think if you have not had a chance to read their findings and their report, which is pretty, I got to tell you, I'm pretty excited with what the matches that they came up with. And I'm not going to share that with you, but I'll leave that up to Lloyd and David here, or to Mr. Allen too. But I just want to say thank you, and I'll leave it at that.
You're pushing on it.
Thank you. I'm Lloyd Hinion. I'm a board member of the CAN, and I just wanted to very briefly say that what a pleasure it was working with the Department of Consumer and Business Services. They took in all of the concerns and issues that the stakeholders and advisory committee had, and I think because of that, we now have a very actionable report that can translate into a very good bill. And just on the benefit side, the federal government will be contributing $9 for every state dollar of state dollars.
Share that with them.
Well, right.
That's good. That's economic development. $8 back from Washington.
Thank you, City Frederick. That's exactly the way I'm seeing it. Oregon will benefit, but the big winners will be the COFA group, who have not had access to health care. And rather than just doing crisis intervention, they'll actually get some help up front, which should help them a lot. And they're very excited about these prospects, and they're quite a deserving group. Thank you very much.
Representative Kulik, members of the committee, thank you again for this opportunity. My name is David Anatok, the president for the Oregon Marshallese community and also a board member of the COFA Alliance National Network. And as mentioned, it was definitely a privilege to work with DCPS on this report coming up. And most of what's been said is what was in my heart to share today. I'm just really glad that we're here and want to thank you. And thank you, Representative Olson, for willing to help us carrying a bill for this next session.
Great. Thank you very much.
What's the name of that?
Mr. Allen?
Is the report in our materials?
Pardon me?
The report you're referring to in our materials?
I think.
I'm sorry?
Is the report they're referring to in our committee
Yes.
materials?
It should be on all lists.
Which one is it?
It's here. I think it's this one here. The COFA Pat Allen report.
Right. The COFA.
Mr. Allen, will you join us, please?
There. Okay, got it. Okay, thank you.
Thanks. Good afternoon, members of the committee. Chair Greenlick. My name is Patrick Allen. I'm the director of the Department of Consumer and Business Services. I'm joined today by Chicky Flowers, who's one of the program people with the Health Insurance Marketplace, who worked extensively, and you can tell from some of the comments, I think did some outstanding work with these stakeholders to complete the report. I think we emailed you each individually the report about a week ago, and it's up on OLIS now. The bottom line, couple of pieces. You've heard the 9-to-1 leverage that's available. In terms of federal funding, there's a lot of detail in the report, and we can answer questions for you if you'd like. The bottom line number is that the cost of a program like this that would provide Medicaid-like benefits to COFA members would be something on the order of about $1 to $1.8 million, including about $200,000 in administrative costs for the department to administer. Chicky, do you want to talk a little bit about the process we went through to?
So sorry, good afternoon, Representative Greenlick and members of the committee. As mentioned by
Please
the COFA,
introduce yourself.
I'm sorry, my name is Chicky Flowers. I am the project manager for the Oregon Health Insurance Marketplace. And the process that we adopted was very collaborative. We had invited members of the different COFA nations, as well as members of the legislature, insurance companies, consumer advocacy groups, and other state agencies, and also the Oregon Health Authority. And together we met several times throughout the last few months since the passage of HB 2522. And we also formed a very formal advisory group of 15 members, equally represented by the different stakeholder groups. And through those meetings and the different extensive communications we had with the different stakeholders, stakeholders, we were able to put together a report that would provide a program to about 1,000 to 1,500 COFA residents in Oregon who would be eligible for this program because they are not eligible for Medicaid. And what would be, if there's enough funding available, we would be able to provide a program, or rather a program that provides plans that will provide better coverage, better than a platinum plan for these COFA residents.
Are you going to come forward with that plan as a part of the marketplace?
I'm sorry, can you repeat that, sir?
Are you going to come forward with, will that plan be a part of the marketplace, or will it require a different
sir.
waiver?
So all these plans will be sold through the marketplace. They are cost-sharing reduction variants of the silver level plans that are currently and will be available in the exchange for 2017 and onwards.
Let me just add to that a little bit. I think the issue will be if you collectively choose to provide that level of funding by whatever mechanism, and there are a number that we could probably talk about, we would be able to design a vehicle that would be offered through the marketplace to be able to meet that need.
So it'll come forward to us as a part of your budget proposal? Is that the...
No. We would expect that there would be a need for a bill to want to go ahead and fund a program, and then we can design a program that would deliver that funding.
Is somebody putting that bill forward?
We're not as an agency bill right now.
I think it's Representative Olson.
What?
Representative
Olson.
Representative Olson and the different advocacy groups are putting together a COFA
I mean,
healthcare.
we have, among the three bills we have now, and we're down to three, so we don't have to have much discussion. One would combine the basic health plan with the 1332 waiver request that you made as a single bill, and we've confirmed that that can happen. But this is not necessarily a part of that bill, so I was wondering.
This is not a part of that bill, sir. This is a separate endeavor, but we are aware of these other initiatives, and we will work in tandem.
Well, I just want to make sure there's a bill coming forward for that.
It's a personal bill of Representative Olson.
Is that right?
Yes, sir.
Yes.
Oh, good. Okay, that's all I was checking.
Cool.
I wanted to make sure we didn't miss something. Representative Olson's gone now, right?
Yes.
Okay.
We would be happy to answer any other questions you have regarding our recommendations report.
Question, please, Chair.
Bueller has a question.
Yes.
Thanks, Chair Greenlake. I see in your report that a couple of your key assumptions on the cost of the program is the size of the household and the health of the individuals who would be insured. Have you done a sensitivity analysis on if you're off on those estimates, what the difference would be?
Representative Greenlake, Representative Bueller, the sensitivity analysis, can you expound further on what the difference would be?
How would it change if all participants didn't live in a one-person household?
The change would be in terms of budget, the amount would be a lot less. So the projections provided in this report is the maximum scenario.
Okay.
It assumes 100% uptake on day one, full 12 months of eligibility. Everyone lives in a one-person household, and everybody takes advantage of the maximum out-of-pocket costs.
In short, our sensitivity analysis was every place there was a choice to make, we went high.
Okay, that's what. Thank you.
Okay, great.
Thank you very much.
Yeah,
Thank you.
Very well done, by the way.
Thank you.
Thank you very much.
And that your request will be in that bill on the basic health plan as well. Okay, let's move to a brief report on the basic health plan.
Martin Taylor, Janet Bauer, please.
Since you have the whole 10 minutes you asked for.
Thank you.
got
We are
10.
grateful.
You got 5. That's right.
Good afternoon, Chair Greenlick, members of the committee. My name is Janet Bauer. I'm a policy analyst with the Oregon Center for Public Policy. I want to thank you for the opportunity to share the recommendations for program design for a basic health program in Oregon. I want to start first with context. As you may know, consumer advocates in Oregon have been focused on finishing the work of health reform for several years. Several years ago, we formed the Inclusion, Affordability, and Innovation Coalition to address remaining gaps. In 2014, we worked with you to pass a feasibility study of a basic health to see if this option under federal law could offer modest income households a high quality coverage package that they could afford. The results of the study by Wakely and the Urban Institute were promising. This past session, we worked with you to take the next step, to have a group of stakeholders work at designing a basic health program that would help those modest income households at little or no cost to the state. That resulted in HB 2934. Since June, with the help of staff at the